like that. Just little hints from Dr. Rutledge. Okay, we're recording. Well, again, kind of a background. We have a patient who had the surgery and had pretty significant bleeding. In other words, it would bleed on the floor, it bled through the get dressings and the gowns and things like that. And she came to me with what seems like a very reasonable question, like, okay, what's up with this, Dr. Rutledge? And what we usually answer, which is sometimes unsatisfying, but it is the answer, and that is, well, you got stabbed 5 times, and being stabbed with a spear sometimes leads to bleeding. And most of our patients, yeah, duh, I get that. It's just when other surgeons stop stabbing somebody, they stitch them up so they don't keep bleeding. And the answer that we have is, we can't stitch you up. We can stitch you up, but where you're bleeding from is at the base of a long tunnel. It's not the skin that's bleeding, but it's the abdominal wall, which is anywhere from 2 inches to 3 inches to 4 inches to 5 inches to 6 inches to 7 inches to 8 inches away. And that is where the muscle of the abdominal wall, the abs, you know those guys on TV with the ripped abs, well, right underneath those abs are some blood vessels, and some are teeny tiny. In fact, they're microscopic, and if you hit one of those with the port that we use, that usually stops pretty quickly. There are some blood vessels which have grown up to be big enough to get a name. And when you have a name like aorta, femoral artery, brachial artery, carotid, when you have a name as a blood vessel, you've really graduated. You're in the big time. And so if Dr. Rutledge happens to cut one of those, they will bleed quite a bit. And there is some blood vessels that are right under the abs that have a name, and one of them is called the mid-epigastric artery and vein. And when we put our ports in, the ports are really a lot like this pen. They've got a blunt plastic tip, maybe they're more like this pen, and we cut through the skin and then we push it in. And most of the time, like you've seen the other patients here this morning, it splits between the fibers and doesn't cause any bleeding at all. So you saw little bits of bruising today. But if we happen to actually get a hold of that blood vessel, especially if it's big enough to have a name, it will bleed. Okay? Now, what could we do? We could take you back to the operating room if you have a bleeding blood vessel, make an incision so we can go down 7 inches, which would probably be about 7 inches wide, and go down and put a stitch in it. But having done this for 12 years, what we know is it always stops. So when we go and talk to our patients, that can be a little disconcerting. You know, we go, leave it alone. Stop picking at it. Stop worrying about it. And they go, it doesn't seem right that I should be bleeding on the floor after your surgery. How do I get a good surgeon who doesn't make me bleed on the floor? And the answer is that we just, as the Rolling Stones say, we just let it bleed. And after a while, it stops. But it's not very satisfying for the patient. Most people are pretty nice about it. They don't say what they're really thinking, which is, where did we get this guy? But we did have one really serious event where the patient was bleeding just like this, and he was a pretty famous attorney. And he and his wife were not very happy, and we couldn't understand why. We would explain this and explain it, and it wasn't very satisfying. And what we found out later is a real tragedy, is that he and his wife had had a young boy that had leukemia. And when you get low platelets, you get bleeding, and it's really serious, and you really need to do something in that case. You go give platelets and treat them, and the chemotherapy is too much, and they have to put him in a sterile room so he doesn't get infections, and they ultimately lost their son. So when we told him there's nothing to be done, he was very skeptical. But ultimately he's done really well, and but I have to apologize to you. I apologize, but it's going to be fine. It has always been fine. In 5,000 people, it just gets better on its own. But I apologize you had to go through that. But it happens every once in a while. So to all of you watching the video out there, and those of you having surgery this week, you might have some bleeding. And don't hesitate to tell me about it, but I don't really care. there might be somebody who needs something done. Now, I think there's a story that the nurses were telling me that you had a roommate too. Is that right?
Yes.
Do you want to tell a story about your roommate?
Yes, she was a former nurse, and she was adamant that I should be getting x-rays to find out if there's internal bleeding, and somebody should be coming to check this, and she was just very opinionated about this. And she had a lot of experience, and I'm not a medical person. And every time I'd sit up, there'd be blood, and I felt sorry for the guys who had to keep coming in and mop the floor.
And then you have this nurse go, "For God's sakes, why can't you get a good doctor?" And she's right, but here's the interesting thing. There's bleeding that falls out on the floor, and then she said something, and you quoted her, I think accurately, what would be dangerous and what would worry me is internal bleeding. Okay? But internal bleeding hurts, and it has a whole different set of issues. Some bleeding outside we don't like, we are disappointed by it, and I'm sad we're talking about it here. It's you're bringing me down, man. You know, because we don't want anybody to have any complications. We want just everybody to be perfect, and you're not supposed to be here in our good clinic. The people with complications are supposed to be here on Mondays. But it happens. You know, we do get some complications. But the therapy for this is not what she said. You don't need x-rays. You don't need to put you through anything. You just leave it alone and it stops. And to stop it, we could stop it, but it would require surgery. Now, other people get, you know, with medical backgrounds, they'll make up stuff like, why don't you put pressure on it? Well, putting pressure on a wound when it's on your fingertip is very easy to control the bleeding and works great. When it's at the bottom of a big tummy, it's just not going to happen. So, but we've seen people where we've come in and the nurses have these big elastic bandages, you know, and there's this great big lady there with a giant elastic bandage like this, and they're but it does bleed. Some of our patients do get bleeding, and it always stops. So we're sorry you had to go through that emotionally worrisome time, because I'm sure that sometimes it crossed your mind that I'm not sure this guy knows what he's doing, but...
Mostly it was, is it ever going to stop, and am I going to quit bleeding through all the clothes I brought with me?
Right.
So I would walk around with a big extra lump in front, just a bandage. But my support person, you know, became a nurse and learned how to change dressings and cut tape and all kinds of things.
And we apologize. That's a complication. It's my fault. But the only thing to do is just be patient. So.
It didn't hurt.
Right, and that's the key. Internal bleeding hurts, and that's a whole different red alert warning. All the things that the other wise nurse sitting next to you was right about is internal bleeding. But if it bleeds from the outside, we know a lot about that, and it stops. So you're a good sport to go through it. A lot of people who come back with the bleeding are not having a smile on their face like this. They're like, I paid all this money for this? What kind of care is this? But you just leave it alone, it'll stop. Other questions?